Hello, I'm Robert, fact checker and science blogger, and helping people who are scared of various things on Doomsday Debunked. And this time on Facebook. And this time it's about this idea that we've got COVID-19 on so many different countries, and surely that means it's uncontained and it just can't be stopped. Well, that's not true at all. And to look at this, we need to look at this mathematically. And instead of just instinctively, you just sort of look and see all these countries. What you've got to bear in mind is that a lot of these dots are already contained. And like there, Cameroon, you've got all these cases in Africa, that's one of the most concerned. But they're containing it so far, just a few cases per country. One, and for instance, as long as Africa, sub-Saharan Africa, can contain it like that, then there isn't any outbreak in sub-Saharan Africa at all. These are just cases from imported cases. And then there's some local infection in some of these countries, but if they can stop that, they're still being contained. There's a big outbreak in several places. There's a big outbreak in China, of course, and then there's a big outbreak in South Korea. And that's the big outbreak in South Korea, but they're containing it. And so what matters is not how many countries it is in, but whether it's being contained. The actual number of countries means nothing in terms of where this is going in the long term. Look here, look at how South Korea, this is from the Wikipedia, where they have a rather good way of presenting it, and look how the percentages are going down as it keeps going, and even the actual numbers is down to a lower number than it's had for a couple of weeks now. And this shows, South Korea shows that even outside of China, it's nothing special about China, they contained it, South Korea contained it, Italy's on the way up still, it can contain it. So how can, and the WHO keeps saying over and over again, and they just released this new statement, which I just did a blog post about. Go down to it. And I just highlighted the key points in the title. It can be controlled. No country should allow uncontrolled spread. It harms your citizens and other countries too if you do that. And so the spread of this virus can be significantly slowed or even reversed through the implementation of robust containment and control activities. And allowing uncontrolled spread should not be a choice of any government, as it will harm not only the citizens of that country, but affect other countries as well. And we are seeing remarkable solidarity. We just take one country amongst all those in the world to say, oh, we're not going to contain it anymore. And say India would say, oh, we're not going to contain it anymore. Then within a few weeks, there would be hundreds of thousands, even millions, eventually, in India who have it, and it would be just about impossible to contain it to one country once you've got so many people with the virus, and that's the WHO's experience. We have to stop it, not just for ourselves, but for other countries. And they are very experienced. They've stopped the Ebola virus, for instance, in the Congo, and they deal with 200 outbreaks a year, and they say it can be stopped. So why is this possible? You might think, how can this be possible when it's in so many countries? So you need to look at the maths. And I'm trained as a mathematician, so I know maths doesn't come naturally. It doesn't come very naturally to us. And even if when you're trained and you know the basics, you know how to do all the different mathematical operations, it's still not very easy for human beings to think mathematically. We have the capability, but you have to train yourself to do it. And in fact, historically, over thousands of years, take thousands of years for humans to learn very basic things, like how to do ratios, how to add, how to, using zero, using negative numbers, those all took centuries for human beings to get to grasp these basic concepts, and those are the most mathematical, best mathematicians in the world. And they still didn't have those ideas for centuries. So math doesn't come very naturally to us. But we do have to think about this mathematically, and we can do it. So, for instance, COVID-19, and the latest studies are saying it's got now an odd number of about 2. And that means that each person on average infects 2 more people. So when it's spreading, then in the early days of the outbreaks, it seems in multiple different countries, it doubles roughly every 3 days. So once you've got 100 cases, then in 3 days you'll have 200, another 3 days you'll have 400, another 3 days you'll have 800, and then by then, that's after 12 days, you've got 1,000 cases altogether. And so if you add all those numbers up, 100 plus 200, 1,500. So it's no wonder that if you're not doing anything to stop it, and you don't even know that you've got it, as happened in Italy, then once you've got 1,000 cases, then you've got to act very, very strictly and quickly to stop it at that point. And so that's why Italy's having so many problems. Because not only that, but they had to gear up to stop it. But now, suppose you don't have to stop every infection. If you can stop 3/4 of the infections in this case, then once you've got to say 1,000, then it'll be 500. And so I've taken 100 there. Say you take 1,000 instead, then it'll be 500, then it'll be 250, then it'll be 125, and then it'll keep going down. And it's the progress of that is inevitable. Even if you've got 1,000 cases, eventually it's going to go down to 0 if you can stop 75% of the infections. You don't have to stop all of them, just 3/4 of them, and it will go down very quickly. And that is why South Korea is succeeding, as I showed you. They are stopping the infection. They don't have to stop all of them. In fact, it turns out that this disease is spread by close contact, and prolonged and close contact, and it's very rare. Even when you've got a couple, a husband and wife, they don't tend to infect each other, even when one of them has got COVID-19. So it's not at all easy to infect people with this disease. And typically, if you've got people living in the same household, only 1 in 10 of the people they're close with will get infected. So it's not a difficult disease to stop if you can do just a certain amount of measures. So remember, if you can get that 1 in 10 down to 1 in 20, say, and then to 1 in 30, then it's going to start going down instead of up. So you don't have to have everyone to stop it for everyone. You've got to stop it for most people, and then it's mostly in clusters. And so if you do the contact tracing of everyone that is infected, that is in contact with someone who's infected, and you get all of those to isolate themselves, and then you quarantine everyone who's got it, then your clusters are quickly going to stop. And that's mainly how South Korea has done it. Because it's done through close contacts and prolonged contact, then generally the people know each other, or they all go to a religious gathering, and whoever organised the gathering knows them all, each other knows them all, and so on. So in this way, that's why the tracing of contacts. So that's one way you can stop it. And these are 3 different things we can do: the case finding and the contact tracing. And if you catch the cases, even if you haven't managed to trace all the contacts. So this is at the later stage. If it started off with, say, if you got to 1,000, you don't even know it's there, then there are probably several thousand people in your community eventually that are going to get it, that have already been infected but they aren't showing the symptoms yet. And so at this point you can't do all the tracing back if it's gone too late and you don't have all the intermediate cases. And they've been infected, some by mild cases where they got over the symptoms quickly. So in that case, what China has done, because they've met exactly that situation and they got over it, and in the provinces outside of Hubei province, they didn't need to do lockdown. What they did is very rapid case finding. And they found cases within 3 days of symptoms, using all the fever clinics and things like that. And if you can catch all the cases within 3 days of symptoms, they've only had 3 days to infect other people before you find them. instead of 14 days before they would feel ill enough to say, oh, I'll go to the doctor because I'm feeling really ill. And then they go to the doctor because they don't know they've got COVID-19, and they've been wandering around. And it's only 2 weeks later and they feel ill enough to go to the doctor, because this progresses quite slowly, this disease. You can have a very mild version and then you recover from it, or you can have a mild version that slowly gets worse over a couple of weeks. So if we can catch these people who've got the mild version by public education, say going to the fever clinic and lots of tests, and if we can get them within 3 days, then it hugely reduces the infections. They'll still infect some people, but remember, you've only got to reduce it. You don't have to stop it. So that's a way to stop it. And this China and the international experts say this is the main way that China stopped it, outside of Hubei province, by rapid case finding. And so this, of course, it requires the government to gear up and say, we've got to be ready to test everyone who goes into a fever clinic. And so they've got to really scale up their testing. And then if they do that, then they can stop it just by this case finding. Then, as I said, the contact tracing, if you're at the cluster stage especially, if you haven't got to it where it's widespread in the community, you can stop it completely by contact tracing. Again, a few people will slip through the net, but you get more than your 75%, and you can stop it very quickly if you've just got a few isolated cases, like, say, Mexico, these countries in Africa I was showing, and then you do the contact tracing, and you get them all to self-isolate. Then it's the experience of most countries that you just stop it dead at that point. You don't get any cases. And generally, if you can catch the people coming in and at the airports and so on, and you say, report as soon as you get a fever if you do, and then they do report, and then you immediately quarantine them, and the doctors don't get infected, you do it properly, then usually they haven't infected anyone else. Because remember, typically, I think only a few people, only a small percentage of the people, and I can't pick off the top of my head, but only a small amount or small percentage of the people who get it even infect anyone else. So if your country has had 6 cases, say, then most likely none of those have infected anyone else. If you catch it quickly. And even if you didn't catch it, they probably wouldn't infect anyone else. If you have only 1 case, then most likely it's not going to infect anyone. So most countries with 1 case, it doesn't infect anyone, even if they catch it quite late. So then if you trace all their contacts, then it's very unlikely that any of them have it. But in the very remote case that one of them does, you catch that one, and then it doesn't go any further. So even if you've got limited local spreading, but if you did it by contact tracing, these are the contacts you already knew, then it's not going to go anywhere. So the case finding, contact tracing, and then, so that's the case finding of doing it within 3 days. There's contact tracing, where you trace all the contacts of anyone infected. And then there's public education in hygiene. And if everybody was to wash their hands thoroughly for 20 seconds, between the fingers, tips of the fingers, your fingernails, thumb, wrist, back of your hands, and if you wash all of that for 20 seconds, and you do that regularly during the day, and then if you get out of the habit of touching your face, so I've been gradually training myself for the last few days to get out of the habit, so that if we do get an outbreak here, I will know what to do, and I won't be touching my face anymore. So if you can get out of the habit of touching your face, this is very useful if there is later an outbreak in your area. And you can touch your chin, but it's maybe better not to touch, just get out of the habit altogether, because you get absent-minded and then you touch some other part of your face. And if you just get out of the way, just not touching your face at all, because it doesn't get in through the skin. The virus can only get in through your eyes, nose, mouth, through direct contact with mucous membranes. It can't get through the skin. So if someone shakes hands with you even, then it's not going to get into your skin. Just wash your hands and it's gone. And it's a virus, it's not a microbe. It is not resistant to soapy water at all. Use soapy water, it will all 100% be gone. You don't need anything antimicrobial. Just soapy water will do it. And so if everyone did that, then keeping a distance of 2 meters from people who are coughing, and sneezing especially. But remember, this virus doesn't actually tend to spread in those ways. You could be sharing a taxi, you can be sitting next to someone in a train, you can be sitting in a plane all the way from Wuhan to the Europe or Americas, and sitting next to someone who's got the virus, and you won't get it. It's never happened that anyone has got it from anyone else in a plane or a train that they know about. So if we were to do all this, then it would be extinct in the wild in two weeks if everyone did this. And as I said, the experts, they went all the way to China. They spent 9 days. So here is Dr. Bruce Aylward at the press conference, and the press people asked him, "Why aren't you wearing a mask?" And he said, "If I was a contact, I would not be here. A mask is not enough to protect you. I would not be here. I would be in quarantine if I was a contact." So he is an absolute expert on epidemiology, and he was in charge of stopping the polio outbreak, of the almost complete eradication of polio. He was in charge of that worldwide. This chap, in charge of the worldwide almost complete eradication of polio. He is a real expert on diseases, and he knows exactly what he's doing. He went to China with the other experts, and 13 experts from around the world. Head of CDC from Nigeria was one of them there. And so he's also an expert. So Nigeria is well placed to handle this. And they wandered around at all the worst places in China. Wuhan. They spent the last day and a half in Wuhan, just going around looking at everything, to the doors of the fever clinics. They didn't go into the fever clinics because they didn't want to become a contact. They did this. He washed his hands every half hour when he was in China, thoroughly. And he kept a distance from anyone he was interviewing. His voice was hoarse from shouting at people because he was interviewing people at a distance of 2 meters. And when talked to all the doctors and nurses treating the patients, talking to the people who got it, talking to the people living in these areas and what they're doing, traveled around China everywhere. And then he came back, and because he's an absolute expert and knows what he's doing, then he could say quite confidently, "I don't have it, and I'm not a contact. I'm not even a contact. I have very low risk of this." You go to almost anyone, and I'm about the lowest risk you can have. 0 risk, really. So we can all do that. And if we all did that, then it would stop within 2 weeks. And the only people left in hospitals would be the only ones left that still have it. And then they would continue to have symptoms for up to 6 weeks after that, before eventually all cured. Within 8 weeks, 2 months, there would be nobody left on the planet who had the virus if we all just did this hygiene. So learn how to do that yourself. Teach everyone you know, your children, any sort of elderly people who who need reminders. Put big pictures on doors as you're going out to remind everyone to follow this basic hygiene, and you will be part of stopping this from spreading. Incidentally, you're also helping to stop the spread of flu. And the other thing is, if you get a cough or a sneeze, then to cough into your elbow, so try and get into the habit of doing that as well, or use a tissue if you've got tissues, and immediately put the tissue into a locked bin. But if you're out and about, there aren't going to be many bins around, that's better probably. And if you're greeting someone, it's best to, Dr. Tedros recommends touching your heart. He says elbow bumps are not the best thing, because you're still pretty close to someone to do that. And so this is only if there's an outbreak in your area, but it's good to get used to that before it happens, then you can help stop it. So, and so then as I go back as a mathematician, looking at this big map, the global cases, and I don't see, lots of countries that it is uncontrollable. I see lots of places where if they were to do these measures, and this map, let's look at this one, and this map, that one sometimes is a little bit glitchy when you move it around. Oh yes, it's showing South Korea. Anyway, I'm going to stop soon. But so I don't look at that and say, oh, it's in so many countries. I see lots of countries in which it's being controlled. And then some countries, a couple of countries where there's an outbreak, there's Iran and Italy, where there's an outbreak that is not currently under control, but is being controlled. It was uncontrolled for a while. And then I see all these places which are exactly being controlled. And then you look at China, then if you go and look at China, then you look at these and you see how the very few currently sick. And then if you go and look at the maps of these things, then you can see they're just levelling off and it's being controlled, totally controlled. 576, that particular province. Then they haven't had any new cases since February 2026. So they've completely stopped it since February 26. You click around in the China area and you'll find that with most of them. In all the ones outside of Wuhan, then it's pretty much over. And if you look at Hubei, then again you see the same remarkable thing, that they're just levelling off. And the very few, only a few hundred a day now, they've had the least. And since for over 2 weeks, new cases in China, especially the ones, most of their cases from outside China. So absolutely, this can be controlled, and the number of countries is just nothing at all. It just doesn't mean it can't be controlled. What matters is the R0 number. If we can reduce this down, so if we can stop 3/4 of infections, then it will stop. And that is why the WHO are absolutely confident that it can be slowed down. China shows it can even be reversed. And then if we are very, very vigorous in how we apply these measures, we are very prompt and we do it now, we can definitely stop it. So I hope this helps some of you to understand. This is what the WHO have been saying for weeks. I hope some of you will understand now a bit better why they say it and how it mathematically makes sense. So if any of you want, I did this for the Facebook group Doomsday Debunked, so do join that if you're scared of various things, and also if you want to be able to help people there, especially if you're good at fact checking and looking for reliable sources, and also if you're good at working with people who are scared and autistic people, then very welcome in the group. And anyone who's scared, to join our group. Be sure to read the rules at the head of the group before posting there, and if you want to subscribe to this channel, then again, if you like these videos, then do subscribe to this channel.